The Scarlet Haven Nursing Care receives a lot of referrals from Inova Fairfax Health System and from Children's Hospital and other neighboring hospitals. We have a strong presence in Northern Virginia, and we're currently working on creating a presence in the southern part of Virginia because we realize there's a vacuum in there for home care and specifically for pediatric home care. Some babies go home sick, but they're not sick enough to receive private duty nursing, so then they are allotted maybe 3 to 5 visits of skilled nursing follow-up, depending on the acuity of their situation. So this determination is obviously made in the hospital by the case manager prior to discharge, and we at Scarlet Haven make sure that the nurses come out to see them. Now, because of the population that we serve, we have to make sure that the nurses educate the families on the care of the babies, because if it's a limited time care, we usually need to make sure that whomever is taking over after the skilled nursing visits have completed knows how to continue with and not put the baby in any risk.
And one of the other things we do, we don't turn any babies down. Even if they don't have insurance, we incur the cost because it's a need that the children need. We cannot have them go home and not have that continuity of training. So there are a lot of times that we incur the costs and we implement the necessary training the family needs before we start providing care. So a lot of the babies leave the hospital without Medicaid. And we are then in turn able to have our nurses do a lot of what would you say?
Follow-up care.
Follow-up care.
Just to make sure that even though no one's paying for this, the babies are fine and they're taken care of. So skilled nursing visits are a very integral part of the insurance programs all around. And a lot of the hospitals utilize it in lieu of private duty nursing.